The home care bag has been used by home care clinicians for decades to carry needed equipment and supplies like stethoscopes, blood pressure cuffs, scissors, soap, bandages, thermometers, and gloves into the homes of patients. The bag has changed over the years, from the simple black leather bag Lillian Wall carried while making visits in New York's Lower East Side in the early 20th century, to the multi-compartment bags of today, including backpacks, wheeled suitcases, shoulder bags, and fanny packs. This module briefly reviews the care and management of the home care bag, otherwise known as bag technique. When practiced well, bag technique reduces the spread of infection and assures you that you will have the supplies and tools needed to readily provide care. So what's in your bag? What you pack in your home care bag can be broken down into two components: single-use items and reusable items. Single-use items are those supplies that you will remove from the bag at the start of a home visit and not be placed back in the bag after use. Reusable items are those items you will use from patient to patient and will return to your bag after use. Examples of single-use items include alcohol prep pads, lancets, wound care supplies, tape measures, thermometer probe covers, and gloves. Examples of reusable items include stethoscopes, blood pressure cuffs, digital thermometers, bandage scissors, pulse oximeters, and soap and hand gel. Let's organize your bag. You should designate the largest compartments of your bag for clean or single-use items only, and dirty or reusable items only. It's actually misleading to call one compartment dirty, but we do it all the time. The word dirty suggests that medical waste should be carried out of the home in this compartment. This is not so. Dirty refers to where you keep your reusable supplies that you use from patient to patient. Medical waste should be disposed of in the patient's home. But there is one exception, and that is used needles, syringes, and other sharps. These should be disposed of in an agency-provided red sharps container, and this container should be carried in an outer compartment of your bag. So when you pack your bag, you want to put all single-use items in one compartment, and all reusable items in a different compartment, or compartments. You may want to designate a small, easily accessible compartment as a place to keep hand gel and soap, and another compartment for your sharps container. Let's talk about home care bags and infection control. You will carry your bag from patient home to patient home, and in doing so, you may transmit microorganisms including MRSA and VRE from one patient to another. There are a number of steps you can take to minimize the transmission of microorganisms. Step 1. On entering a home, place your bag on a visibly clean, hard, and dry surface. Shoulder bags can be hung on a doorknob or the back of a wooden chair. Rolling bags should remain on the floor on a non-carpeted area. Avoid placing your bag on upholstery, carpeting, and bedding. Step 2. The first thing to remove from your bag is your soap. Then wash your hands every time you enter your bag, regardless of what compartment you are entering. Step 3. Keep your bag on a visibly clean and dry surface in the trunk or covered area of your car as you travel from home to home. Step 4. Clean reusable items when visibly soiled and at least weekly by wiping them down with disinfectant wipes. Step 5. At the end of each month, it's good to get in the habit of emptying your bag and wiping down the inside and the outside with disinfectant wipes. Allow the bag surface to dry before repacking it. This is also a good time to restock your bag and to check expiration dates of single-use items, especially sterile saline, Foley catheters, blood collection tubes, and dressing supplies. Now, there are special circumstances. Patients known to be infected with multi-drug resistant organisms like MRSA and VRE, C. diff, bedbugs, and/or lice require special precautions to avoid transmitting these infections to others. Do not take your bag into the homes of these patients. Consult with your manager for single patient use equipment and guidelines.